So in this next section, I will be talking about, for a couple of slides, a little bit more about stress and the stress-pain connection, and I'll be reviewing anxiety and the difference between stress and anxiety, because that's important to know. So in review, for the stress-pain connection, unregulated stress can cause inflammation. Inflammation can cause pain and discomfort, and also remember that there's inflammation as part of the MS process that we talked about last week. There's a connection with the MS and inflammation, which is why some of the medications that help with inflammation also help with symptoms like cortisone or the steroids. Stress can cause sleep disturbance, and as we talked about, sleep disturbance can also cause stress. And sleep disturbance can cause fatigue, which puts even more stress on the body. And fatigue is something that many people struggle with MS. So you begin to see the stress-pain connection even more. But I want to talk about something called anxiety, which is different than stress. As I talked about before, stressors are out there, and it's not possible to live life without stress. Even good things cause stress. Changes cause stress. So we don't even want to live a life without stress because we want some fun things to happen, some surprises, some nice things to happen. But anxiety is a little bit different. Anxiety is about excessive worry. And many of us can be anxious about something from time to time. That's completely normal. But I'll be talking about when it steps over into something that is more clinical. What happens with anxiety, and the difference is there's that feeling of being wound up, tense, restless, difficulty controlling thoughts and feelings. So there's just that same thought over and over and over again, or that just uncomfortable feeling that you can feel it in your body. The difference between anxiety and an anxiety disorder is the duration and intensity of it. And if you think that you may have an anxiety disorder, and we'll talk about that later, it's really important to consult with a mental health professional and not use these couple of slides to diagnose yourself. So some symptoms of anxiety are mind racing, difficulty relaxing or sleeping, preoccupation with anxiety-producing thoughts, a tensing of the body, and this tendency to avoid certain things, certain thoughts, certain activities that may produce the anxiety. What about anxiety and MS? Well, anxiety affects at least a quarter of the people who are living with MS. And why? Because MS is an unpredictable and uncertain disease. The symptoms, the course, the outcome are often all a question, and it creates anxiety. We get anxious when we don't know. We get anxious when someone can't give us the answers. It's normal. But anxiety may lead to an increase in physical discomfort, even suicidal thinking, or an increase in alcohol consumption, alcohol abuse, prescription drug abuse. One study found that both newly diagnosed patients, and this is MS patients, and their partners demonstrated a high level of anxiety and distress. And this is newly diagnosed, and you can understand that it's not unusual for people that are newly diagnosed with MS to struggle with anxiety. But when does anxiety become a disorder? The most common anxiety disorder is called generalized anxiety disorder. There are other ones And more information about them is in your handouts and in the references that I've given you. But I just wanted to talk about this one, the most common one. The DSM diagnostic manual that's used by mental health professionals to diagnose has listed some of these things as characterizing generalized anxiety disorder. At least 6 months of excessive anxiety and worry about a variety of events. The important word here is excessive, and this has been going on for 6 months or more. Difficulty controlling the anxiety and worried. And it's present for most days over the previous 6 months. Feelings of being wound up, tense, or restless, concentration difficulties, irritability, significant tension in muscles, and difficulty with sleep. An important piece also is that the symptoms cause significant distress and problems functioning in daily life. So if you believe that you are struggling with an anxiety disorder, there is help. And let's go to the next slide and talk about what that is. There are well-researched effective interventions. Emotional support, such as psychotherapy, some of the cognitive behavioral therapy that we've talked about. Actively problem solving will help with anxiety. Meditation and relaxation, breathing, exercises, physical exercise not only helps with stress, but it really can help quite a bit with anxiety. And there are some really good medications that can help you with this also that a doctor can prescribe for you. So I want to just review very quickly. There is a difference between stress and anxiety, and there's a difference between anxiety and an anxiety disorder. So even though you may be very concerned about MS, does not mean that you have a disorder. It's for you to know if you're really struggling, if this is affecting you on a daily basis, and then to bring your concerns to a qualified mental health professional to talk about this. And you can begin, if you don't have ability to get to a qualified mental health professional, you can begin talking with your doctor about this and then decide together whether it might be helpful to get a referral. And there are referrals available to you through the MS Society.